I'm working about 40 hours a week, sometimes 60, and I don't have health insurance, and I wish I did.
I'm disturbed by the fact that I have a mother-in-law in rural Iowa who's in a nursing home, and the healthcare conditions in rural Iowa are beyond reasonable. There's just no way that people should have to mediate what kind of healthcare services they get based on where they're located in the country.
I think that we have come to a very serious and sad point in the history of American healthcare. It is hard to say exactly what needs to be done. The steps that need to be taken are so massive. But I have some hope now that we can actually make it work. Whereas 6 years ago, had you caught me, I would have raged and probably just ended with a sigh. But things are looking up, I guess, and it just takes everybody stepping in the right direction slowly, and we will get there soon enough.
Well, I think the biggest problem is probably cost control, and until we can find some way to do that, we're not going to really solve the part of the problem, and healthcare will end up swallowing our economy. And I think a good way to do that would be a system of price controls, which they do in Germany and Japan. And those systems both have higher standards of care than we do for a lower cost.
What do I think about healthcare in America? I do think in some ways it is the best in the world. Of course, I have to say that because my wife's a pediatrician. But I think it's a terrible shame that we don't provide universal health care in this country, and I hope that we're going to work toward it and continue to work toward it. I also think that the insurance companies are making way too much money off of the normal people who are working in this country and simply trying to obtain health care.
I'm originally from La Paz, Bolivia, and I live in the United States now for over 30 years. And my folks come to visit from time to time, and one of the things that worries them the most is the fact that health insurance is very expensive here, while in Bolivia they have at no cost access to doctors, dentists, and hospitals, and they can't understand why a country like ours does not have access to health insurance as we do in Bolivia. But to understand better what type of health insurance Bolivia has, it is a modest means of hospital and doctor access, but it's enough for people not to have to worry in paying premiums or having to work in order to get health insurance. Everyone, whether they work or not, receive health insurance in Bolivia.
Yeah, I guess my basic thought on healthcare in America is that the outcome that people get paid for is illness. And I was a consultant in business for a long time, and I know that wherever the incentives are, that's the direction the business will go. So if you have a system in which everyone makes more money, everyone in the business makes more money than from people being ill, then you get more ill people. So in a nutshell, I think that's the fundamental issue. One thing that puzzles me is that the people that are making the money eventually will be ill and will be victims of the same system.
The healthcare system, for many years we did not have health care. My daughter was able to get health care through the state of Florida because I was a substitute teacher and didn't make very much money. Now I'm a full-time teacher and we both have health care. I am not very impressed with it. I spend over $300 a month in premiums. I have huge deductibles and co-pays, and just doesn't seem very affordable or effective right now. And something really needs to be done because our healthcare system is out of control and needs much improvement, and I'm hoping that the government can do something.
So right now is our biggest opportunity to really get healthcare reform, and really I'd prefer a healthcare revolution versus a healthcare reform, but I'm looking for healthcare that is affordable, that is really, really accessible to everybody, and for me the only way that that's going to happen is to have a single payer program, and if we're going to go with the reform strategy, then at least have a public option. 53% of the people in the United States are women, and so if we really want to serve a vast majority of people in the United States, the healthcare reform package has to include a whole spectrum of reproductive health care, from preventive exams to vaccinations to gynecology care, prenatal care, and including abortion care. If we don't do that, we're not going to be serving a majority of the people in this country. So now is the time. Let's get single payer, let's do it right, and it'll be cheaper for everyone.
I believe healthcare reform is necessary in this country because it bridges the gap between the two social classes. I believe that the upper 1% shouldn't be the only ones to afford reasonable health care, and I think that even people from the lower classes should be able to see specialists if they need to. There shouldn't be anybody in this country that can't afford to go to a doctor or get treatment.
So I don't have health insurance, and that makes me feel a bit vulnerable, because it's very expensive to get sick in our culture, because anytime you go to the emergency room or you have any type of ailment, emergency room costs and doctor costs are very, very expensive for someone who's not sponsored by a corporation or a group health insurance plan. And so I'm definitely interested in finding ways to help people like me get affordable health care. And I'd also like to see people who have health care actually have the companies fulfill their promise within the policies to actually help people out. I've heard many stories of people being not covered on life-threatening diseases and then actually dying because the insurance company won't help them out. And so I'd like to see, health is a basic human right, and I'd like to see all people have the right to live well.